Hello and thank you for joining our webinar, Introducing ClearV, a new solution to treat the veins you can and can't see. This is Doug Carroll, and I've been with Sciton for over 20 years. I've developed and launched many Sciton products, including current patient and physician favorite, Halo. I have experience in multiple areas, whether it be product development, sales, or marketing, and I'm excited to tell you more about our latest product, ClearV. We will not have a question and answer session at the end, but please feel free to send questions during the webinar by using the chat box on your GoToWebinar dashboard. Or you can send them into info@sciton.com and we'll get back to you. All participants will be in listen-only mode during this webinar presentation, and additionally, this event is being recorded for your future reference. All right, let's get started. So ClearV. These are the general product definitions that we want to discuss, and we'll go into each of these in a little bit more detail, but let's just sort of look at them one by one here. So the wavelength that we're using with ClearV is Nd:YAG 1064 nanometers. You have the ability to change the fluence up to 400 joules per square centimeter. You can change the pulse width between 5 and 200 milliseconds. You can also adjust the cooling between 5 and 25 degrees Celsius. You can change the spot size on the handpiece now from 2 millimeters to 6 millimeters. And then there's SVI, our subsurface vein illumination, which utilizes 590 nanometer diodes and 605 nanometer diodes. All right, let's take a look at these sort of one by one, and hopefully this will be useful. So our current UI is over here on the left, and what you're able to do is adjust these multiple settings. So this is where you would make your fluence adjustments. This is where you would make your pulse width adjustments. This is where you would make your rate, your repetition rate adjustments. And here you can change the temperature of the sapphire. Now, what you'll see in the left-hand corner over here is one of the key parameters that you're going to want to get right, and that is vessel size, because vessel size has to do with pulse width. So we're going to give you a vein card. You're going to measure the vein. You're going to touch vessel size, whichever it may be. Let's just say, for example, it was a 0.5 millimeter vein, and then it will give you the appropriate pulse width automatically. All right, this is your spot size adjustment. As you turn the dial on your handpiece, these numbers will change. That range is anywhere, again, from 2 to 6 millimeters. You can change the intensity of the aiming beam on the screen, or you can change it on the handpiece, and we'll take a closer look at that. And this is where you can adjust the volume. So as you move, you're going to hear a beeping sound that correlates to your repetition rate so that you can have easy and safe usage. All right, so that's the current UI. Now, the future UI that we're working on, the goal is simple. It's just make this easier for you. So what we're currently trending here is you're going to make a selection on whether it's the face of the body, and then you're going to pick the vessel color, whether it's a reddish colored vein, whether it's bluish colored, or whether it's purple. That's going to help us make some determinations on fluence. And as you select vessel size, whether it be small, medium, or large, that's going to get us into the right range for adjusting pulse width. Now, this screen may slightly change, but you get the idea. What we're trying to do is just make this easy for you as the user to get to the right treatment setting. So the first thing we want to talk about here is the TEC-powered pre, post, and parallel cooling. In the past, we had a cooler that sat on the floor, and then you had a hose that ran up and along the arm, and it was a little bit bulky. So this was a pretty big, significant change for us, and it just really makes this thing so much easier and sleeker to use. So as you can see here, this is going to get cold. It's going to then chill your sapphire window, and it's all there built into the handpiece. Now, this is the VascuZoom, and this is where you change the spot sizes. So again, in the past, you had to physically change spot sizes. So you'd have a 2 millimeter and a 4 millimeter and a 6 millimeter. Now it's all integrated into this dial. All you're going to do is turn the dial, select the spot size that you want. The user screen is going to recognize that spot, and you're on your way. So subsurface vein illumination is really the key feature set of the entire product, in my opinion. And so what SVI is, so let's just say what it allows you to do is it's going to give you enhanced visualization so that you can better map the veins And then you can make better, more intelligent decisions when selecting the user parameters. So again, when you can see these veins better, you're going to know where to start, you're going to know where to end, you're going to have a better chance to select the width of these vessels, which is really important, as I mentioned earlier, in getting good settings. But at the end of the day, what this is about better information. Information that no product to this time has given you the ability to visualize in this manner. And this is, again, the thing that we're the most excited about, and we're going to go through some specific examples of it. So here on the left are your yellow lights, your 590 nanometer yellow lights. So you're going to have 3 different settings. This is your first click, this is your second, and this is your third. And what that's going to do is adjust the brightness of the LEDs. These pictures probably don't give you the best example of that, but if you look closely at the illumination here in the ring, you can see the difference between the 3 different settings. Now, yellow light is going to primarily be used for the more superficial veins. When you start getting into the deeper veins, veins that even will now go from red to some bluish tint or some purplish tint, veins that are deeper, you're going to be looking through using orange light. Okay, and that's 605 nanometers. And so the same here, you have these 3 different clicks. You've got the low setting, the mid setting, and the higher brightness setting. Now, you can also combine the 2 and get a view of using both of these at different brightness settings. Now, what this is going to really allow you to do is, veins there's a mix of them. They're oftentimes it's not just as simple as they're superficial or they're more moderately placed. You have a smattering of veins. Sometimes they're both. And so in that case, that's when you're going to want to start using both of these blended together in order to get that information that we need. So what you do is you simply change those brightness settings on the handpiece. So you're going to start off, the diodes are going to be turned off, and you're going to click here when you want yellow. You're going to click here when you want the orange light, the 605. And then if you have 2 clicks of this, you can then add 2 clicks of this. You cycle through 3 clicks, gets it turned back off. So again, you can use them both independently or you can blend them together. So what that really means, it'll be better seen through some slides here that we're going to walk through. Now, the aiming diode also is user adjustable on the handpiece, so you can turn it from light to from a light setting to a mid brightness to a high brightness. And that all is going to depend on the lighting in your room, etc. So SVI, a deeper dive, and let's just take a look at it clinically, because that's where the real, I think, visualization of how handy this feature is going to be. You're going to get a chance to see it. So we're going to go through a few slides. Over here is going to be a video. So I want you to first watch this video right over here. You're going to see either 1, 2, or 3 clicks. And then what I did was took some still images to give you an idea of how visualization changes as you cycle through these brightness settings. All right, so let's just start here. So you can see 1 click, 2 clicks, and then you can see the 3rd click. So, if your eyes are seeing what I'm seeing, each of those intensity settings gives you better visualization. Now, sometimes the 3rd click will be too much. It might wash things out, so you'll cycle back through. But this particular vein, and I think that this is a good example here of what a vein really looks like in I would call a pretty moderate lit room. Okay, like most user rooms have this kind of fluorescent lighting, and you're looking down over the handpiece. So I think this is a pretty good representation. So without SVI, without looking here, and then you'll see how crisp the veins look here, this is all that you're seeing. And you can only treat what you're able to see. Although what you see with the naked eye in common lighting settings really isn't enough information. And so you can see where when you get into that 2nd click, look how much crisper the vein becomes now. Look how you can map this vein better now as well. You can now see that, it doesn't just go from here to here. It actually extends all the way out here to the left, runs its way all the way over into here. Now you can also see where these smaller veins can branch off from the larger veins. So it gives you better visualization. You're going to be able to select the pulse width much more precisely, which, as we talked about, is an incredibly important user setting that you really need to get right. You need to get it right because if the pulse width is too short, you may have purpura. You may actually blow that vessel up. And that's not our goal here. We don't want to get bruising. If your pulse width is too long, you may not have a good result. So being able to really properly see the size of these vessels and measure them appropriately, it is a really big feature that we're hoping is going to be incredibly useful. Now, what you can see also, as I mentioned, is you really get a much better view. See these thread veins over here? You don't really see them very well. But here you get this really great picture of what those veins really are and how to treat them. And, just at the end of the day, the goal here is better visualization is going to result in a better result. All right, so let's keep kind of clicking through and looking at some different examples. So again, I think a pretty clear, pretty good, well-lit scenario here. And you can see there that that first click and that second click really bring the vessel to life. And when we break it down and look, so this is what you're currently looking at. It's fuzzy, you don't really know where that vein is. So if you didn't have this illumination, you're going to really be limited in your treatment and user selection settings. And then more importantly, just your mapping. I mean, you might have only treated this piece right here. Maybe you get to see this, maybe you get to see this. But man, 2 clicks, look at that visualization. Now you can clearly see and map this vein better. You can see that, what if you only treated this because you couldn't see very well, but with the illumination, look how you get to see this bigger vessel underneath. That really is probably where this is extending off of. So we want to treat this bigger one first in order to get rid of some of these smaller ones. In the past, maybe you would have only treated this area. And what you would probably have found is that you'd get just another vessel that would branch off. So our goal here is to work from big to small, because a lot of these bigger veins, again, are the culprits of where these smaller vessels extend off of. So with this visualization, I'm hoping you see the same thing I see, and that is just so much more information, and which is going to allow you and the patient to get better results. Let's kind of keep clicking through here. So again, a vein that I think you could see pretty well. I think you probably had a pretty good chance, although, when you look closer at, and this is that third click, and this is the way that you're going to see it normally, you're probably going to only treat this area right in here, because you don't really see that the vessel extends all the way over here, and that this vessel probably comes off of this branch. So again, being able to see something that you couldn't currently see is what we're hoping for here. One more video here. Another vein that I think you can see pretty well, through just traditional lighting, but you just can't see it this well. So here, if you were to measure this vein, or you were trying to measure from here, you just don't have the definition of that vein. This is a linear vein that has very clear definition, but only when you get through 2 or 3 clicks, and you can really see where this vein begins and where it ends, and then you can again see all these little branches that come off the bottom of this vein. I think you can also see these little thread veins quite a bit better, here from here to here, but you'll see that it actually extends up here all the way down to here. All right. Same thing, 1 click, 2 clicks, and 3 clicks. So this is, a little, you can't see this one quite as well in the beginning. The lighting isn't quite as good as some of the previous, but I think it's also a representation of just an average treatment room. When you're looking over the handpiece, there could be some shadowing going on. When you're at different angles and you don't have direct light that's coming directly down above, sometimes this is just the way you see it. And what I like here is, first of all, so much more definition in this vein. But then also right in here, this blurriness right in here gives me certainly an indication that I may want to tread lightly here. So let's just say, for example, let me tell you what I'm talking about. So let's just say that you were trying to trace this vessel out, and this vessel amounted to let's just say a 15 millisecond pulse. So you're tracing it and tracing it and tracing it, and then you hit this blur right here, which is probably a deeper vessel. So what's going to happen here is you're going to have it set to treat this, but then you're walking into a much larger vessel. And so what could happen if that is indeed a vessel is you're going to be too short. You're going to have too much peak power, and you're going to blow that vessel up, and then you're going to bruise, and then that could turn into hemosiderin staining, and then nobody signed up for that. So this is a subtle example of where more information can be incredibly useful for both you and the patient. Now this is one I think you can also see pretty well. You can see this, I think that you wouldn't need the vein illumination in this particular example, but look at what I want you to really notice is this over here. Look how much more definition you get off this vein right here, which is what you're going to want to treat first, because you can see that a lot of this comes off of this, right? Now here, you may have only treated here, 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 and here, and you would not have treated all the way into here. But you can see how that vein, this deeper vein, goes all the way over here. See, left to right. So now with better information, you're going to want to treat this. Then you're going to want to come through here before you start worrying about cleaning up all these smaller ones. What you may find is that these smaller ones here end up blanching anyway because they're branching off of this larger vessel. So you're looking at this kind of information versus this. And this is, to me, another good example of being able to see and map where visualization really does matter, and SVI should be super helpful here. All right, so just go through a few just examples without video. This is what you see. You get, with one click, much better definition. The second or third click, so much more. Again, see how this is branching off of this. So we're going to start here, go all the way down. Whereas here, maybe you would only have treated from here to here. You can't really see how it extends up in this area, but that could very well be where that vessel is branching off of. All right, so we want to deal with these larger veins first, then the smaller. And in order to see them, you really need to be able to use the subsurface vein illumination. Another nice example, traditional lighting, one click, or that's one click, and this would be the third click. So again, same thing, so much more information, it's going to be helpful. Red vessels, this is kind of common to see these lighter sort of vessels here. Never really quite sure how to measure those because they're not as crisp as they would be here. So knowing better the size of this vessel, adjusting the proper pulse width, the proper fluence with the right spot size based on better information, and you just end up in a better spot. All right, same thing. This, again, is another good example of a vein that you would only treat from that end to here. But what you may not have seen is this darker, bigger vessel that sits into here. Again, I've seen this many times. Good, good, good. You're treating good, good, good. And then all of a sudden you hear this popping sound. And that popping sound is that vein. There's too much peak power in that vessel, and then it explodes that vessel and you end up with bruising. So again, having even just this information right here can be the difference between an average treatment or maybe getting yourself into not necessarily a complication, but a side effect, and then possibly being able to eliminate that side effect by being able to see better. Another good example. All right, so let's take a look at ClearV in use. So we're measuring, we're seeing, we're changing our settings. Now let's take a look at a physician actually using it.
Oh, they're just disappearing. Oh yeah, this is an amazing video. Make sure you give me credit. Absolutely. Oh, I love this. Trace, you're gonna love it. And when you have the joules dialed in for the oxyhemoglobin, and then you just change the pulse width for the veins, it's easy.
So do you feel like you could...
So that's great, right? I mean, he's excited because he has good information. You know, as he mentioned, once you get those settings dialed in, but that vein illumination really does allow you to feel really confident about setting the right fluence and the right pulse width. And you can see that when you get the settings dialed in right, this is fun, you know, for everyone. So I'll give you another example here in use.
Here we go. That's 4. Okay. I got about 3 more.
So we're using kind of a 1, 2, 3, maybe even a 4th pulse technique, generally a 1, 2, 3 technique in order to have good patient comfort. You know, it will build up as you move through these veins, and as the veins become darker and bluer and larger, there is more pain involved. So good technique along with good information allows you to clean up these vessels pretty easy once you get the right information. Lastly here,
Just 2 pulses.
so 1, 2, pause.
Good job. Okay, 2 more.
2, pause. There we go.
Okay, you doing good? Here you go. 3 more.
All right. You can just see that vessel close down. And that really is the end point here. It's vessel clearance. I know that in the past we've talked about vessels getting blurry or maybe getting darker, but what you really want to do is have that vessel close down when you can. So vessel darkening to a clinical user is an indication that you're on the right path. It's vessel clearance that actually is the optimal result when given the opportunity. So that was a good demonstration right there. 3 good videos. Let's look at the final video here.
You there? Okay. Yep, video's running. Okay, here we go. That's 3.
So, wow.
Okay. And 3 more.
So we're on the legs. We're using a little bit larger spot. We're at 1, 2, 3. And see how more blood filled into that vessel? That's another good reason to kind of take your time here and go 1, 2, 3. If you're moving too quickly and that that blood is still hot or heated up, you could possibly get into a purpuric situation. So it is nice to move at this 1, 2, 1, 2, 3 technique. And you can see when you do that, you're able to just clean these vessels up. All right. So that's ClearV. You know, that's SVI, subsurface vein illumination. I could go on and on, show you a bunch more videos, but I think that you get the idea that what we're after here is good information, a good result. So let's look at let's look at some before and afters. So this would be ClearV, before and after. Really nice indication for Nd:YAG also is on the face when you start to get these larger vessels. So we have a couple other handpieces, of which is the clear silk handpiece. We have BBL, which are possibly both could be used in conjunction with ClearV. However, these are just examples of just using only 1064 for larger vessels. And you can see that you get a really nice result when you have good technique and when you have good selection of parameters and good visualization. These are also nice. The ClearV is nice to use around the ankle. You know, we will still recommend that you use sclerotherapy whenever you can, if you choose to, if you have that particular, if you've learned that particular skill. It can be used without, but still, if you can use it with sclerotherapy, then it's ideal. Now, what happens when you get to the ankle, though, is sometimes you get these vessels that are too small to even get needles in. So in this example, and although these may have been probably large enough to get a needle in, if you could just kind of visualize, because I'm sure that you've seen smaller vessels of which it's really nice to be able to come in and clean those up with ClearV. All right, probably another good, this is only 1064, but certainly could have used sclero and 1064 together here. Same here. Again, although these are Nd:YAG only. All right, now this is another area where there really is not another solution for, and we see lots of it out in the clinical arena. And that is these sort of blue vessels that run all the way up. Oftentimes you see them up here in the forehead, and then you'll see them run right under the, right in the orbit right here. Now what you would do here is you'd put metal shields in. You would try and pull this area down outside the infraorbital rim, and you'd use Nd:YAG. You know, these, and there's really no other way to treat these vessels. And when you start looking at faces, especially in lighter skin types 1, 2, 3, you'll see a lot of this. And these are vessels that really a lot of people think that there's really nothing that they can do about it. And Nd:YAG is the best way to treat these. Now, of course, you want to be safe around the eye because Nd:YAG is a long wavelength. So we want to try and not work inside the infraorbital rim. But if we can pull this down outside of this bony area here, then you're going to find some really nice results for a patient who really has nothing else that they can go to. So a good example, you can sort of see how this, we're trying to stretch this out here with our fingers while we treat it. This is fun. Patients really like when you can take care of this because, again, they didn't think that there was anything really that they could do. All right, so ClearV and BBL together, this would be a port wine stain where we're going to use the two together. You can see that this is 6 treatments. So, you know, port wine stains are never going to be a one treatment and you're done type of vascular formation. So what we want to do here is use the combination of the both, and you can see a pretty nice result. This would be a nice ClearV BBL, where we're going to use BBL as much as we can, and then 1064 on maybe some of these larger vessels. Although I will say BBL probably could have treated most of these using the 560 or the 590 filter. However, a lot of times around the nasolabial area, you'll see a lot of veins that go away with BBL and then they'll come back. So oftentimes you'll need to go back with a wavelength that's a little bit deeper. And so while this isn't a clinical presentation, it's more of a feature and product set discussion. This is a dangerous area with 1064. So you want to make sure that you fill that area with gel, you get really good cooling, you move slow. And if you do all those things, then you're gonna get some nice results. Another example of ClearV and BBL together. All right, so that's really it for ClearV. That's the definition of the product. You're seeing what subsurface vein illumination allows you to do. Hopefully you get a good understanding of the value of that feature. But while this presentation didn't include these other 2 modalities, again, having these 3 comprehensive vascular solutions, having a ClearV, having the ClearSilk handpiece, which is going to give you better skin, better luminosity, better treatment for superficial flushing is also one of ClearSilk's home runs. And then, of course, all the things that BBL using the 515, 560, 590 filters are going to allow you. This is the whole package. This is our first real foray into vascular treatments. Using these 3 modalities is as comprehensive as you can get with Sciton products. And this is all that you're going to need in order to treat really almost any vascular condition that presents itself. So we have some other really great vascular webinars. We've got from Dr. Campo, there are the BBL and ClearSilk, and highly recommend that webinar. There's treatment of rosacea with BBL and Nd:YAG, and then he's got a really nice presentation on BBL versus the pulse dye laser. So if you have any questions, again, you can email us at info@sciton.com, and we will be in touch shortly. The webinar's been recorded. It'll be posted on Sciton.com under the archives for future viewing. And watch your inbox for invitations from Sciton to future webinars and events. And thank you. I hope you found this presentation to be useful.